Hello, I'm Gail Hogan, and welcome to Health Talks. Today I'm joined by two special guests who have made it their life's work and legacy to leave a lasting impact on women's health. Joining me are philanthropist Soter and her daughter Sarah Kay, who have just announced a $15 million gift to fund a new research program dedicated to women's health at the Ohio State University College of Medicine. Sarah and Sally, welcome to both of you.
Thank you, Gail.
Sally, I'm going to direct this first question to you because I'm interested as to why you thought this was the right time to support women's health research.
Well, I tried to do this years and years ago, and nothing happened. But they have changed. They have a wonderful new dean, and she was all for this. In fact, we had fun discussing and interesting to know what to do. And we thought, and I talked to my daughter and my husband, and this was the time to do it.
And why was Ohio State the right place to do this research for women's health?
I wouldn't think of another place because we've been affiliated with Ohio State for years. And I just felt it was a good thing.
Sarah, your family had a long history, a long legacy supporting critical health issues. What inspired your family to focus on this effort?
I think maybe seeing the inequities in health with women and all across the board, I think really blew home during COVID especially. I think when we've talked about and we've noticed differences how women are taken care of in emergency rooms, everywhere. And I think that really impacted us. And Ohio State was a great resource and a willing partner to level the playing field with women and men, health issues, especially with women.
So this new program will be called the Sarah Soter Women's Health Research Program. Can you tell me what your family's focus is or what you hope to accomplish with this?
I feel like our family, my particular family is interested in health equity, treating women who don't get care, having them get colonoscopies, breast screening, diabetes testing. That's important for us in all aspects of a woman's health. And I feel that even going to women with research with drugs is important, and that will be addressed with this initiative as well.
Sally, what kind of specific types of research will your gift fund?
Well, Sarah mentioned several of them.
Right.
Besides heart, you have diabetes, Alzheimer's disease, anxieties, which are a great thing, depression. It goes on. And it just is important to start doing all of this for women.
So this is running the gamut. It's not just specific to, as you said, heart or diabetes. You're looking at a broad range, right?
Mm-hmm. And cancer. There are quite a few things.
And Sarah, why was this important? You talked about seeing disparities, but what do you see those disparities in? And as far as testing, where is that disparity in research and clinical trials?
Right. I think, just culturally or geographically in Columbus, you see economic and socioeconomic disparities. Access to primary care, that was it's a noticeable disparity in our city. I think the research with women and men with drug testing, I think women have more side effects. I think 76% more side effects of medicine than male patients do. So I think this is a home for all these issues and a support center. And I think this will go out in the community and help these women who don't feel comfortable going to a doctor to come in and, see someone that's just in a female environment, which is important.
Were you surprised to know that many clinical trials were done on men, but then used for women, and research done on men and used for women?
Go ahead.
Well, yes, I was.
I hit a hot spot, I could tell.
Yes, and that's why back in 2003, when I read the article in Time magazine, and that was 20 years ago, this past 28th of April, that I read that article, and I knew that I wanted to get involved in that. It was important. But it wasn't until 2009, I believe, that even the American Heart Association came out and said that they had to do testing on women and not men. And there's a great disparity in even our shapes, hearts, how we have a heart attack or how we do this or that. It's all very different. So I'm happy to see that this now is taking place.
And women are in the research lab. I mean, your
Yes.
focus is women side by side working. That was
Yes.
important to you.
It's very important. And I think that they will be able to share the information while they're working together. It couldn't be, well, I couldn't be more pleased than, and my daughter and our whole family's more pleased in seeing what's happening, going to happen.
And Sarah, you feel the same way.
Oh yeah, I definitely do. So my grandparents, I mean, they love this university, and obviously with the heart hospital, I mean, they wanted that to go into the future. And I think this is just a continuation of our family's devotion to academic and health excellence.
Mm-hmm.
What do you see in the future, Sally? Where we go from here?
Oh. Well, maybe better give me 5 more years to figure that out. That is fun. I just am so pleased because this is a big step. And I'm pleased that we are able to do this to help people. And I think it should continue. And more people, if they see what we're doing and if they know they can do something like that, they should step forward and be part of it.
Well, we appreciate your generosity, and Sarah, you as well. Thank you, ladies, both
Thank
for joining
you
me
very
today.
much for
And
doing
thank you
this.
for this wonderful gift
Wow.
for our College of Medicine, our university, our medical center. Thank you.
Thank you.
Thank you.
And thank you for being here as well. And I know myself and women everywhere are going to benefit from this important work, as all generations to come.